One of the state's largest health insurance providers could stop covering some ER visits. Doctors are warning that the plan would put patients' lives at risk. But a top Blue Cross Blue Shield executive told our consumer justice investigator, Kristen Severance, that those doctors have it all wrong.
This was supposed to start on Monday, but the state has questions on how it will work, so it's been delayed for 60 days. But that Blue Cross Blue Shield official told me the only people this policy may hurt, the owners of those freestanding emergency rooms.
Tight chest, trouble breathing, feeling faint. A real emergency or a false alarm. Most people would head straight to the emergency room to find out. But some doctors say a new policy by Blue Cross Blue Shield of Texas will have patients second-guessing going to the ER when seconds count. In a letter to brokers and consultants, the insurance giant said our HMO members may be required to pay for the entire emergency room bill if they go to an out-of-network ER as a convenience. This policy affects about 500,000 patients in Texas.
My colleagues would all agree with me that if this policy is implemented, it's going to hurt patients and there are going to be people who are going to die.
Dr. Robert Hancock is on the executive board for the Texas College of Emergency Physicians.
All it takes is one person to sit at home for an extra 20 minutes, second-guessing whether their chest pain is from their stomach or reflux or from their heart.
His group says the policy will force patients to self-diagnose and skip the ER altogether.
I already frequently have patients that make very poor healthcare decisions based on financial concerns. This just further magnifies that.
We're going to request the medical records and look at the symptoms, why they came to the emergency room.
Dr. Paul Hain of Blue Cross Blue Shield of Texas said they will base the decision to pay on the symptoms that brought you to the ER, not the diagnosis you walk out with.
So if you're having what appears to be an emergency or what makes you think is an emergency and it turns out not to be one, that is of course covered.
If you go in for chest pains and it ends up being acid reflux.
Right.
Not a heart attack.
Not a heart attack. Absolutely covered. Chest pain is always an emergency. You should go to an emergency room.
Some groups aren't sold. A letter from the Texas Medical Association to the Texas Department of Insurance says the policy, quote, scares patients into avoiding emergency care, end quote. Dr. Hancock said the policy is not clear and leaves a lot of room for interpretation.
In a letter to the Texas Department of Insurance, said you're asking patients to be diagnosticians.
They did. Their facts are just wrong. I don't think they fully understood that we're requesting medical records and looking at symptoms. And if they understand that, they'll know we're really not asking anyone to self-diagnose. We're asking you to not go get your allergy medicine refilled there.
Allergy medicine refills, head lice, school physicals, all convenience reasons, he says, will not be covered at out-of-network ERs. He said 80% of out-of-network ERs are those freestanding emergency rooms we see all over Texas.
The worries you're hearing being voiced are from the owners of the freestanding ERs that are worried that they won't get to be paid outrageously for convenience care that should have never been there.
TDI sent this letter to Blue Cross Blue Shield asking exactly how the review process is going to work. That's when Blue Cross Blue Shield decided on a 2-month delay. You can read this letter and a new statement from Blue Cross Blue Shield on CBSDFW.com. Doug?
Kristen, thanks very much. Kristen's going to keep following the story. In the meantime, if you need consumer justice, she is always just a phone call or an email away. Her phone number, 817-586-7211. Email address is consumerjustice@ktvt.com.